and otherwise known as the Department of Housing and Urban Development, has deemed appropriate to be used for rent. Next up, we have gentrification, and for our purposes, it's the reorientation of an area's existing infrastructure, housing, businesses, services to appeal to wealthier residents. This usually results in increased property values and displacing low-income people and small businesses. Upzoning is a legislative strategy for changing the zoning to allow for higher value property, for example, from industrial zoned property to residential or more dense use, for example, increasing allowable federal acquisition regulations. We also have sit-lie ordinances. In the US, a sit-lie ordinance is typically a municipal ordinance which prohibits sitting or lying on the sidewalk or in other public spaces. And below you'll see some examples of hostile architecture, which is architecture meant to discourage people from sitting or lying down in public spaces. Next up, conservatorship. Under conservatorship, a judge appoints another person to make financial, medical, and life decisions for an individual they determine is incapable of doing so for themselves. And so those may be some of the topics we get into today. And with that, I want to just jump into the questions since we started a little bit late, and wanted to start with you, Shanti, if that's okay, and get kind of a historical look at where we are at with housing. Could you tell us a little bit about the history of public housing, redlining, and housing broadly before 1970? In the US?
Yeah, so there's so much there. I'm gonna try to keep this like tight and not rambly. Apologies in advance, but you know, I kind of one of the key moments I think of when it comes to like the pre-1970 history of public housing was, and of course there's more before this, right? Because there was public housing that was built, say, like starting in the 1930s. There's public housing even in the Bay Area that we saw that was being built by and for unions, for union members, the sort of like in the broader sense of social housing. But when we talk about the government building public housing, you know, initially it was kind of seen as part of a sort of middle class vision, right? And was sort of invested in, particularly in like parts of the 30s and 40s in certain areas when it was still seen as housing that was appropriate for white people. Over time, that changed with the advent of redlining. You know, with the one key moment is the 1949 Housing Act, which was passed under Harry Truman. It kicked off, you know, it theoretically gave funding for 800,000 or million units of public housing to be built across America. And some public housing complexes were built that some people may have heard of, like Cabrini Green in Chicago, et cetera, under that Housing Act. But at the same time, the Housing Act in 1949 turbocharged urban renewal and and a lot of housing demolition and quote unquote slum clearance. So, you know, it kind of started to define public housing in a way that's still with us today. And I'm not saying that this is just the one thing, but at the same time, other phenomena were going on, like redlining, right? Which I know was just defined, but you know, there was massive federal support for white homeownership in the suburbs, both to encourage segregation and actually use property ownership as an anti-socialist strategy. They were very clear. This was Red Scare times, right? So they were also very clear that they wanted to use property ownership and the model of the suburbs as sort of isolating individuals, making them less likely to engage in collective action, whether that, that was part of the strategy there. And redlining, of course, was just as one of the many forms of discrimination that was, invented by private lenders who have been discriminating for a long, long time. But at this time, around like the 30s, 40s, 50s, especially, that's when it was codified through the Federal Housing Authority, through the Homeowners Loan Corporation. Everyone's seen the maps, although there's some debate over whether they are the real maps, but or whether there were other maps being used. But over time, the consequences that this had for public housing was that public housing was never really allowed to compete with the private market. I don't mean that in sort of like a idealistic competition view. I would just mean to say that it was seen as a jobs program as much as a housing program, but it was segregated very often into areas where, real estate didn't want to invest. So that was one of the problems, and at the same time too, it was going on concurrently with urban renewal. So a lot of the supposed gains that were going to happen from building these public housing units, were washed or lost or washed away, or just offset by the demolition of people's homes and neighborhoods and the dispossession of many communities of color.
Right. And many of those houses never kind of came back. I know that there is so much more knowledge and expertise that you have in this that we hope to get to, just because we are starting a bit on the later side. We're gonna head to the next question. So thank you for kind of setting the scene. Chad, you have a question for Rosemary and some of the others.
Yeah. So by the 1970s, we had more public housing than people who needed it, including in cities like San Francisco and New York. In the 1980s, we began to sell our public housing stock, and housing policy began to shift from public housing to housing vouchers, which became tied to welfare reform, such as character reform in the 1980s. Rosemary, starting with you, could you tell us a little bit about that history of welfare reform? What kind of impact did this have on marginalized groups, and especially Black women?
Well, first off, thank you so much for having me. I think this is in California, so good afternoon for me in DC.
Good evening to you.
So this is a great question. I would modify it just slightly, because I think the sister who went before me, Shanti, helped us to understand something that was quite crucial. So public housing was always envisioned to be provisioned for those who were the deserving poor, right? The upwardly mobile poor. So there was so much character vetting tied to the admissions of public housing that most families that needed public housing never got it, right? With urban renewal, then you had the introduction of eligibility reform that allowed for those who were displaced through urban renewal to be allowed to apply for and be admitted generally into public housing. So that meant the demographic that was most likely to be unable to be rehoused in the private market, housing market or rental market was primarily single Black mothers or elderly, right? Elderly folks. And so in the case of public housing, you start to see more and more experimentations with welfare reform predating 1970s. They go back to the 40s and 50s, where you start to see, arguably, since its inception, arguably, especially when it came to Black families, Black and brown families, there was always this assumption that the Black and brown families needed to be under particular types of surveillance, behavioral surveillance, right? But with urban renewal, you see an upkick in experimentations with behavioral surveillance. And so housing vouchers was promoted by public housing opponents as early as the 1930s too, but definitely started gaining more currency in the 1950s as they complained that public housing was supposedly competing with the private industry. Housing vouchers, I'm currently writing about that in my book. It has a politicized history, given that it was tied to the real estate industry's interest in making sure that the private market controls the construction and maintenance or management of all housing. Housing vouchers is steeped in this history, this anti-Black and anti-Black women history of the assumption that Black folks who get access to housing vouchers or non-white folks who get access to housing vouchers, that there should be some type of character surveillance tied to them. So you start to see as it becomes more and more introduced in the 70s. But even then in the 1970s, it was primarily about construction. So using Section 8 to go to new construction of buildings that property managers or private owners manage. And then it was with Reagan, who then introduced going straight to what we consider the housing vouchers today, in shifting to that model where tenants have to go and take the voucher and go to see if a landlord would accept that voucher. Yeah. And so in my own research at DC, I find time and time again that landlords get to opt out. That's one of the pluses for a lot of these folks who are opponents of public housing and rent control too. They get to opt out of having to accept vouchers or tenants with vouchers. And so now vouchers have become, at least in current parlance, the new proxy for talking about Blackness and other undesirable tenants. So even though, I'm going to give one quick example just so that we can all have some shared knowledge on this. When I moved back to DC, because I've been a part of DC, been in DC because of One DC since 2006. When I moved back in 2017, after I finished grad school, I was looking on for apartments, and I remember going to this one apartment in, I think, Northeast. I'm in Northeast, but it's a different part of Northeast, maybe close to Rhode Island. And the landlord is talking to me one-on-one, and he's saying, okay, well, tell me about your background. And he says, you know what, it's going to be good because at least I know you don't have a voucher. And it became a coded way of talking about who the undesirable tenants are, right? So even though I'm a Black woman, because I was single or didn't have children, that became a way in which to say, well, I'm not discriminating towards all Black people, but at least some Black people will not be able to get access to some of these, especially if they're renovated units. And so what has happened, because the housing voucher has become the primary model through which low-wage Black families, particularly those headed by single Black mothers, has become a proxy through which it's easier for landlords, but also real estate interests to push, to reconfigure the geographical dynamics or the geographical areas and demographics so that Black folks have to go more and more towards the periphery to be able to find access to housing or access to landlords who are usually in underinvested or disinvested neighborhoods that are going through a period of decline. And so that means that now Black families who have vouchers, Black and brown families, have to travel further and further distances. That's also a part of the political history, is that many of the real estate interests who were anti-public housing, but also anti-vouchers too, and some, well, anti-assisted housing where it's constructed, where the buildings are constructed, not vouchers per se, is that they preferred vouchers because it would allow them to use a tool that is amenable to capital interest, shifting capital interest. And so that has meant that Black and brown families have to adapt to whatever the needs are of capital. And that means more and more Black and brown families are subjected to serial displacement.
Wow, that is a really fantastic response. I learned a lot. Thank you, Rosemary. Do any of our other panelists have something they'd like to add or continue?
I'll just add a quick tidbit, which is that it was only a couple years ago that California, at least the state of California, explicitly outlawed Section 8 discrimination on paper, right? The enforceability in practice has been really rough. And we were at a point, and kind of still are, where I think even if you jumped through all the hoops, did all the means testing, et cetera, to get a Section 8 voucher, I think half of the residents in LA, Greater Los Angeles, who got a Section 8 voucher, this is like a 2018 statistic, but half of the residents of LA who got vouchers, their vouchers expired before they could even find a landlord who would take them.
Wow, that's terrible. And the list for Section 8 housing vouchers is extremely long.
Absolutely. Can I just add one more thing? Because my sister brought up an excellent point. Most folks who need housing assistance will never get it. And I think we have to underscore that has always been the way. Affordable housing is treated differently than the means tested programs like TANF, even though that was highly reformed to make sure that there was a sunset period on that. So I think that that's also important. Most folks who need housing are suffering rent burden. They're paying more than their income to be able to live in the housing they have.
Mm-hmm. Rosemary, or sorry, Margot.
Yeah, I was just going to add to that exactly that only 1 in 4. I mean, there are lots and lots of problems with housing vouchers that have just been really well outlined. And in addition to that, only 1 in 4 households that meet all the criteria. And this doesn't even count the fact, as has been described, many people can't use them once they have them, but only 1 in 4 people who meet the criteria get them. It is not an entitlement, and it's extraordinarily underfunded. Not to say that if everyone had them, it would solve things for all the reasons you heard, but clearly if we're only giving 1 in 4 to people who qualify, it definitely isn't going to solve things.
Right, yeah, that's a total dearth of funding for this program. If there are no more comments, I will pass it over to Toshio.
So shifting gears a little bit, we promised you that we'd cover a few different issues that are related, including houselessness. And this is another question that is open to all of the panelists. There's stigmatization of houseless people with some of the common narratives about houseless people all coming in from outside of San Francisco or outside of DC, that everyone has issues with substance abuse or mental health illnesses, that many people refuse services. What are some of the most common narratives that come to mind for you? And how do these narratives lead to the issue of houselessness being oversimplified and perhaps influencing the potentially harmful policies towards houseless people? Is TJ around? Since we haven't gotten to hear from TJ just yet.
Yes, I'm here. And just like in response to your question, there are like, so many like different misperceptions and stereotypes of like unhoused people that like pretty much like govern the discourse on homelessness. Where to begin? You've kind of like, touched upon the magnet theory, such as like, a certain geographical area like is supposedly more desirable for unhoused people to move into there. And you also like touched upon like, the concept of characteristics that people would want to, remain homeless or unsheltered, rather than like, accept like, any service that like, that would like take them out of homelessness, or just like would basically like improve their situation, like, while they're unhoused.
Right.
There's another like, misconception, and like this is tied to the magnet theory, like, that like, that our city, San Francisco, for example, is so abundant in services that like, and we spend like so much money on them. Like, why would somebody not avail themselves like, to services? Why is there still like, so many people living on the streets if these services are supposedly plentiful?
Right.
And those are like the kind of misconceptions that pretty much, as I said, govern our discourse on homelessness. And a lot of the times it's something with our political dialogue, pretty much like feeds into people who are seeking office, want to say that they want to do something on homelessness. And as such, they may propose ideas or craft legislation, which, on the surface, or at least at first blush, makes it sound like that they.
Oh, you know what? You just cut out.
Okay. Can everybody hear me now?
Yes. Rewind 5 seconds.
Okay, well, all the seekers and political leaders love to position themselves as somebody who will do something about homelessness, and they may put off proposals or craft legislation which may give the appearance of doing something on getting people off the streets. However, the exact opposite effect happens when they do, such as sit-lie laws,
Right.
Or the tent ban that San Francisco enacted a few years ago. All that really does is pretty much criminalize the act of living outside. And often there's there are no services that are attached to it, or there may be very little in the way of services, but the people who are supposedly offering these services are usually law enforcement people. Mm-hmm. It's when you have somebody approaching you with a gun and or a badge, with a supposed offer of services, it almost sounds like an offer that you can't refuse, but because it's coming from a cop, you might as well refuse them anyway. And that's in San Francisco, has this unit called the Healthy Streets Operations Center, also known as HSOC, in which several city agencies are represented within this unit. However, that the people who are most prominent in any street clearance where HSOC is themselves are the San Francisco Police Department and San Francisco Public Works. The police, pretty much enforce, these operations, while Public Works usually helps in what they usually clear the streets by taking tents away, throwing them away in the trunk, in a truck, or a trash compactor. And basically, what the approach is they lead not with services, but with guns and garbage trucks.
Right, creating kind of a cycle for people out on the streets. Just to give others some time if they'd like to speak to the question of, these misconceptions, these narratives that are out there around people who end up as houseless, and how they're simplified, how they're used to create policies that might cause more harm than help.
I'd like to answer. So in my research and in my organizing, one of the things that we see a lot in organizing is particularly organizing tenants who are in buildings that are slated for demolition because the developer wants to opt out of Section 8 or and build, usually upzone to build higher density luxury apartments, is that we hear that families are incubators for crime. Black families essentially are incubators for crime, because the Black family has, just like most of our families in racial capitalism, has been reconfigured to have to rely more on our wages post 1970s. So that means now many of us have more extended family members living in the home. Developers and landlords, particularly Section 8 owners, have seized on that logic. Some public housing owners have done, public housing developments, public housing authorities have done the same. Historically, urban renewal prompted more questions about parental incompetence, which I think is still ongoing. This assumption that Black mothers don't know how to take care of their children, so the children will either engage in vandalism or destruction of property, or the parents themselves may be considered unsafe or undesirable. And instead of thinking about the structural solutions, which I'm sure all of us are considering, more often than not, the state and real estate interests are emphasizing just displacement as the strategy, as a poverty elimination strategy. So just removing them from that location and to hell, whatever happens. So moving them to the next district or moving them out in the rural or suburban areas are usually their strategy, is usually the strategy of how they deal with those quote unquote stereotypes, which are structural issues, but
yeah. So kind of a non-solution, like, yeah, totally feel that. Thanks for that answer. So I guess, we could talk about this for so much longer.
I think Margot has something she'd like to add.
Oh, yeah, absolutely. Sorry about that.
Oh, no, that's okay. I mean, I was just going to, a lot of what I was going to add was going to say, I think it's just important to note how these stereotypes play in against taking responsibility for sort of structural issues. For people who are currently homeless, really talk about mental health and substance use problems, even though we know that we know exactly how to house people and to support people if they have those problems to be housed successfully, but they're highly stigmatized conditions. And so people will, I give lots of talks on homelessness and every single audience member is like conservatorship or like mental health or substance use problems without talking about the like longstanding impact of these structural issues, the underfunding of affordable housing, the way that that our housing has been so just shaped by structural racism. All of these get sort of off the hook, and instead we have these conversations about things like mental health and substance use. And then when you counter it with really strong data that even people who have mental health and substance use problems, are very easy to house. We know how to do it. We have the answer. People sort of will respond with anecdotes about, the one person who they walked up to on the street and, and sort of often further traumatized. I think this idea that everyone comes to places, every city in the country is convinced that I call it the like Wobergon effect, that they're the place where everyone wants to come. And it is like this very racialized view of like these bad people, are coming and sort of invading us without recognizing that exactly the opposite has, that like most, homelessness is worse in high cost areas, and those areas have successfully displaced people through their policies, but we never measure the people who've been displaced, only the people who they feel like come in.
Yeah, and the vast majority of the homeless population in our city is our former residents of the city. So people aren't flocking in; they're being generated here because of our failures. Margot, while we're riffing on this, what is the experience of being unhoused for people in San Francisco and beyond? What is the relationship between mental health, ER usage, law enforcement, and being unhoused? I know this is an area you study a lot.
Yeah, look, I mean, people who have mental health disabilities and substance use problems are at a higher risk than the general population of becoming homeless, because these are highly stigmatized disabilities that that make it harder to compete in a tough job market and tough rental market and all of those things. But we also know that there is that, you know, most people who are homeless do not have these disabilities, and that being homeless itself leads to these. We know that the experience of homelessness is so incredibly traumatizing and disorienting. People don't sleep, they get attacked. They are terrified. Every bit of their mental energy is like, where are they going to get their next meal from? That we see that people's substance use problems and mental health problems get worse when they're on the street. As a primary care physician, I couldn't think of anything worse than being homeless for maintaining people's housing. It's like literally maintaining people's health. It's exactly the opposite. And our entire healthcare system is really set up assuming that people have homes. And so our decisions about who gets treated as an outpatient or inpatient, et cetera. So what you see is people have co-occurring conditions, which might make them sicker. People have less chance to get access to care that can manage conditions so that they don't become big problems. And that once they become big problems or before they become big problems, they have much less access to our system writ large. So people are much more likely to need to use the emergency department, to need to be admitted, to need to be readmitted. If they get discharged, they're much more likely to require skilled nursing facility care or institutionalization when it could easily be avoided. And this is why I, as a practicing physician, spend most of my time actually trying to fight for housing, because the things that we can influence through our healthcare system really pale in comparison to these structural issues with housing at the center of them.
Oh, thank you, Margot. TJ, I think you had something to add.
Yes, I just would like to speak to the question. A couple of years ago, the coalition basically did a survey amongst like 600 unhoused people in San Francisco as a way of conducting a needs assessment study for how to spend prop C funds when they become unlocked. What we found is one out of every two people who we surveyed have some kind of substance issue that's that's going on untreated, and and we also found that 40% of our respondents had no mental health care in the last 5 years. And I guess that that goes to where are the services for people who use controlled substances or have some mental health diagnosis. The truth of the matter is that unhoused people who have these issues face significant barriers in getting treatment. Long waiting list, offices that are only open at certain hours, and with the pandemic that we're having, a lot of physical locations have kind of had to close down or curtail their hours. So there are there are great access issues that unhoused people are facing. One of our great talking points, when we were working on the Prop C campaign to bolster homelessness funding, is that housing stability pretty much helps with the treatment. I guess maybe about 2/3 of our survey participants said that when they do exit a mental health program or substance use program, they usually wind up going back to the streets. And how could somebody get well when they don't have a roof over their heads? It's hard to prioritize the people people have to like prioritize their survival needs under these conditions, over like, just like maintaining their street.
Yeah,
And
tragically,
like,
it seems like the
yeah.
the mental health, it seems like is secondary to the need for housing. That's what it seems like. Margot, could we talk for a second? I was wondering how will widening conservatorship laws affect the large number of houseless people with psychiatric disabilities? I know that Scott Wiener has been pushing for the expansion of conservatorship laws, and especially the application to San Francisco's homeless unhoused population. Oh, I think you're still muted.
There we go.
There we go. Yeah.
Am I unmuted? So I think the bottom line is it will have probably almost no effect. Again, this is trying to solve a big structural problem with, with sort of a needle. First of all, conservatorship is should be used extraordinarily rarely. We're basically taking away people's civil liberties. You can imagine it having incredible rife for abuse. We do have laws and have always had laws on the books to support people if they are at urgent risk to their own life or to that of others. Those have always been on the book. What conservatorship doesn't do is it doesn't provide any resources. Conservatorship doesn't magically materialize housing. It doesn't magically materialize support. And what we find is while there are people who in a moment of, acute suicidality, may be unable to meet their own needs, those needs happen, but they are they're pretty constrained, and they don't really account for much of the crisis that we see on our streets. We know that what works much, much, much better is to offer people material support, to offer people housing, and to provide services that are there for people's voluntary use, not to compel people to treatment, both because there are huge civil liberty problems with that, and frankly, it doesn't work terribly well. What we know instead is when we use something that actually San Francisco was really at the forefront of this movement 20 years ago, to do something called permanent supportive housing. And this is really only for people who are houseless chronically and who have severe disabling conditions that interfere with their ability to be housed, is to offer them housing that is subsidized, to have it not have any preconditions that they be involved in any particular treatment or that they're sober or anything like that. So it's called housing first, which means it's on a harm reduction model, and to offer them the support services that they need to thrive. And what we've shown over and over and over again, and frankly, I'm a little tired of demonstrating it because it is just true, is that if you do that, almost everybody, even people with the most significant behavioral health challenges, can be housed successfully and can thrive. The problem is not that we don't have conservatorship laws, it's that we don't have the housing. That is the problem, that, that the rent is just, as they say, too damn high. We don't have housing that people can afford. We don't have access to that housing. When we have access to that housing, we do need supportive services. We mostly have those services. They're actually mostly fundable through our Medicaid system. We can certainly improve them. We can perfect them. We can make them more robust. But we basically know that even folks who struggle the most can be successfully housed.
Thanks for that. Yeah, absolutely agree. Based on what I've read about the topic, kind of on the same wavelength. Maybe we'll go with TJ, since you are another person who works with unhoused folks on the ground. If you're unhoused today, what are your options? What do they look like here in SF? And then also if Rosemary wants to speak to the situation in DC.
Okay, well, speaking to San Francisco, what options would there be for unhoused people? Fortunately, Prop C passed in the 2018 elections, and after like almost a couple of years of litigation, we were able to like put that into effect. And so, and what like the legislation does, as has been mentioned in the chat, is that it would levy a gross receipts tax of like averaging out to maybe about what, 0.5% to wealthy corporations that are making at least $50 million a year, to fund homelessness services and programs, and like based and what like an unhoused people can hope for and expect in the coming years is like, is this in a flux of funding towards like, such programs, and it would, help to expand options for a person to exit homelessness, or um, and shore up like, substance use and mental health programs, as well as rental subsidy programs, like more money like, going towards the prevention of homelessness, rather than like, dealing with it after the fact. So like so we the coalition are like, optimistic, that is that the city will like commit themselves like, with funding homelessness programs.
Yeah, and right now the funding is there.
Yeah.
Yeah.
And there's the report of the revolving door.
Is this something that people can find at the coalition's website?
Mm-hmm. COHSF.org.
Great. Rosemary.
Can we drop that in the chat? I love it when organizers share resources. This would be great. So I took this question very literally, like what do unhoused people do? And so for us in DC, most folks go to extended family and double up, triple up, before they then have to decide on whether or not they're going to try to live on the streets or other things like that. And so for us on the ground, what we've been trying to do is think through ways in which we could stop displacement. And through our organizing efforts, we've been trying to figure out ways to extend affordability covenants. Unfortunately, that still props up market capitalism or racial capitalism. But I love that option that I think TJ just shared. That's very helpful, and we would take that back. The other option that we're also considering, given the current pandemic, that we know that there is another wave of displacement that will be happening soon in DC, is of course cancel the rent, or at least negotiating extensions on tenure so that people have longer period time to decide their options, whether that be repayment plan that the state subsidizes, or relocation to a ideally same unit situation. We could talk about cancel rent. It's very complicated terrain, given that the federal government just gave a great deal of funding to try to help localities. But again, as we talked about earlier in this virtual panel, all the obstacles and assumptions that are made that prevent folks from being able to get access to that service, and having landlords not using this pandemic as a moment to get rid of their quote unquote undesirable so they can lend their building to population.
Yeah, it's something else. And there hasn't actually been an eviction moratorium in so many places. People continue to be evicted despite the alleged moratorium, which is federally officially ending at the end of this month. But Let's see, do any of the other panelists have anything to add to this? Another very complicated and big question.
Okay, if there's no additions, then I have a question directed at Shanti, but open to everybody. A lot of people might be wondering what's the deal with gentrification. So one of the consequences of market forces in San Francisco and DC, and really everywhere in the United States, has been evictions and high levels of gentrification. What is gentrification? How does it affect communities? And how does it relate to the displacement of low-income communities? Shanti, let's start with you.
Yeah, so I think there's like a lot of, I think sometimes there's gentrification fatigue, and what I mean by that is like people not understanding or not wanting to engage with the word, because like sometimes you hear a lot of things being called gentrification, and like always trying to root ourselves in the fact that it's actually a really important thing to talk about, and it's a really important term. So defining, I'm really glad you guys defined gentrification before I spoke, so I don't feel like too much burden trying to figure out how to explain it. But I will say that what gentrification really is about, more than anything, right? And we see there's so many different visual symptoms of gentrification, right? But it's really about like capital, and about capital flow, about the ways in which an area can be disinvested from. So it concentrated poverty and segregation and disinvestment are also like they're related. They're intimately interlinked phenomena, that and gentrification. So it's really about how areas, they can be disinvested, they can be reinvested of resources, basically at the whims of capital and the people who control that capital, right? Through especially through real estate. And so that's really what gentrification is. And then of course, with that comes in many cases, displacement. So gentrification can start before displacement does, but once it kicks off that process, once you are hit that tipping point from a neighborhood that was disinvested to a neighborhood that is suddenly deluged with investment, but not in a way that's actually meant to help or nurture the community that was already there. I mean, that's when you start seeing, eviction. That's when you start seeing foreclosure. That's when you start seeing predatory house buying, when you're in many major American cities, especially in Black and brown neighborhoods, where you see like, we buy homes for cash, call 867-5309 kind of signs, where you start to see all sorts of, improvements often too, like transit improvements or, more streetlights, even little things like that, start picking up where, finally there are longstanding needs maybe that may even be being met, but they're not being met for the people who used to live there or who are being pushed out. They're meant only for the people coming in. So, and that is really, I mean, I'll say one kind of story that was perfect in a bad way, was that, I think my first week ever at Tenants Together, we have a counseling hotline, and there were some tenants down in Daly City. This entire building was being evicted. And originally, there was some like new development coming, and that what they had noticed was, they had literally, I mentioned streetlights, they had started getting streetlights, there were potholes getting fixed, et cetera, et cetera. And then their landlord was basically like, this neighborhood is getting nicer, and that means that you've got to go because I'm going to raise the rent. So even though they were welcoming of that at first, because it meant that more improvements for them, but they were not able to actually stay in their community and enjoy those improvements. And a lot of them, if I remember correctly, moved way further out into the exurbs of the Bay Area in that building. So
yeah, gentrification doesn't do the communities any good if they're not around to reap the benefits.
Yeah,
it's a real shame. Do any of the other panelists want to add something? You can just unmute yourself and go for it.
Yeah, I just wanted to add to my sister's point about how important state investment is. So I think Shanti talked about the investment, disinvestment, and then reinvestment. And then, the speculative turn is where in the reinvestment. So speculators coming in, trying to realize the highest and best use. which is a part of just the fancy way of saying urban developers or developers in general are always trying to realize the most profits in a certain area. And since the 1970s, a greater investment in the trying to realize higher rents from urban centers is why we're seeing these different waves of gentrification happening more and more in since the 1970s. But I also want to just add one of the things that is seductive about that process is that the mythology put that, you know, poor people will be able to benefit from these better services. When you look at the history, the real estate industry does not care if the poor people stayed. Actually, they were quite obsessed with figuring out how to remove them because they were hindrance to growth. And the state officials actually started to co-sign that a lot more in the 1970s, especially in urban centers, like majority Black urban centers, where the growth imperative becomes really crucial to their reelection campaign. So like places like DC that had experienced stunted growth since the 1950s due to redlining and due to the state subsidizing discriminatory suburban sprawl. DC politicians, a lot of urban city politicians, and even some of the edge cities, like edge suburbs, like Inglewood, California, where I'm from, started to engage in that same competitive thirst for how to realize more higher rents. And that means displacing the poor as much as possible. So again, ultimately, now we're at the stage politically where the best poor, the most deserving poor is the single senior citizen, which I'm sure we'll talk about soon in terms of how the deserving poor gets used in terms of furthering capital interests.
Thank you, Rosemary. I'll hand it off to Shio. Oh, you're muted. There you go.
On a related note, maybe we can talk about, as Rosemary hinted at, like a current housing policy and how it relates to the history that we've been talking about. So almost all of the housing today, whether affordable or market rate, is built by the private sector, mainly by for-profit developers, in some cases nonprofit affordable housing developers, with funding mechanisms in both cases that either directly or indirectly rely on the market. And wondering if the panelists have, some feedback on how this affects what kind of housing gets built, where, and when.
Maybe I'll just say, the single most, people like to talk about homelessness and mental health and substance use, but it doesn't actually track with those rates in the community, right? What it tracks with is a disconnect between income and cost of housing. In California, we're the second worst state in the nation on that standpoint, where we have only 24 units of housing that are available and affordable for every 100 extremely low-income households. So an extremely low-income household is any household that makes less than 30% of the area median income. So that's different in Merced than it is in San Francisco. We are 1 million units short in California of having the right amount of housing. The idea is that particularly if you're living in poverty, it's true for anyone, but it's more true at the lower income you are, you shouldn't be spending more than 30% of your household income on rent, because as soon as you do that, you're not saving, you're not spending on education and healthcare, and you're basically not thriving, and you're at high risk of eviction. And in California, we've had such a total just collapse really of our housing that we basically keep bringing in jobs and jobs and jobs, and we don't bring in housing. And now we're left with this situation where for every 100 households who are extremely low income, we only have 24 units of housing. And that is where our crisis comes in. I will tell you, as someone who works closely with many affordable housing developers, that it is very, very, very hard for them to build housing for that ELI market without a big subsidy, and that the market can't solve that. Like people are not going to they can't make money out of nothing, and they can't build housing if they don't have the money to do so. And it's both the building of the housing and it's a sustaining of the housing. And this is like one of the many big things that happened in the late 70s, early 80s, right? Is that the federal government basically just got out of this business and stopped seeing housing as part of infrastructure, and housing as part of what we need for a community to thrive. And so we've shown that the market cannot solve this issue. I think people can disagree on the best and most effective way to replete that source of housing. But I think the problem is that even when folks build affordable housing, they really struggle to build it for this market. And this is the market that is at highest risk of homelessness. Everybody needs housing. But when you hear conversations about affordable housing, it's often about sort of teachers and nurses and things. And I believe every single person should be able to live in the community that they work in, and it's better for the environment, it's better for everything. But the truth of the matter is, creating housing for people at the higher end, even though albeit affordable, won't solve the homelessness crisis, where we really, really, really need to either raise the incomes and lower the cost of housing for those lowest income renters.
Yeah, no, absolutely agree. I mean, here in San Francisco, we obviously have so many vacant luxury condos that are unaffordable to just about anyone I know. And it's a problem, given that is what is being built in so many cases. Shanti, I know that you had a little bit to add to this conversation.
Yeah. I mean, looking at it from the statewide perspective too, I mean, there's no replacement for federal funding. We need that back majorly, and better than last time when it was mostly used for urban renewal. We need federal funding. We can't, ignore the constraints at the federal level, but even like at the most local level, we need, this is not going to be a surprise coming from me for saying this, but we need tenant organizations all over the state, all over America. Like, we need tenants to be organized to actually like structurally change the politics and put them in the driver's seat and decide exactly what housing that they need, right? And when I talk about tenants, I mean the unhoused too. They're also tenants, even if they don't have a physical structure that they're living in, although many do. So, without actually doing that organizing work, in my opinion, we're not going to get the sort of political pressure that's needed to, for example, build more public housing, build social housing, build land trusts, right? Or community limited equity cooperatives, whatever that is. It's actually going to take a real shift in who is making policy decisions, and whether that's connected to what what the real struggle on the ground is. So, as we're pushing for social housing, I think that's it's a buzzword that's going around, but also there might be a piece of legislation that might take a first stab. We'll see how far it goes. Probably not far, but a piece of legislation at establishing a social housing agency at the state level, et cetera. There are a lot of proposals being thrown out there, and I'm very excited about those proposals. There's still a lot of work that needs to be done. And in San Francisco too, we have a social housing now oversight board, although we don't have the funding that we need to get yet, but I actually sit on it. So we're trying to bring all these different constituencies and groups together that are representing, not just, yes, the teachers and nurses, but also it's not about who's the deserving poor, as Rosemary referred to, and who is not. We've got to have a coalition. We have to have everybody on board, but we really need to break through what's a lot of structural inertia. There are the way that housing is funded right now. There's some folks, and I'm not trying to knock anybody, but there is kind of an inertia around defending the status quo, which is not enough affordable housing at all. So there's a lot of political work that needs to be done to break through that.
Yeah. Is that the same case in DC, would you say, Rosemary?
Absolutely. I don't have much to add other than to just co-sign what Margot and Shanti just said, and just to underscore, the political uses of deserving poor is really about propping up market capitalism, or racial capitalism, as I prefer to call it. So anytime people talk about deserving poor, it is a sure sign that they're trying to protect the system as is. And perhaps that may be why we need to continue to do organizing differently, as Shanti just talked about.
No, it's to highlight these terms that pop up that kind of signal, kind of secret little signals that you're speaking to someone who has already had their mind made up against the idea of social housing. And is TJ out there? Does TJ want to add anything related to this idea of, social housing? If not, we can also move on to the next question, which is, Chad, I know that you had a question.
Yeah, I was wondering, actually, I think Alina can take this one. Alina?
I'm just going to read one of the questions that we already had, which is, what has the effect of COVID been on being unhoused, on becoming unhoused, on evictions, and on housing instability? And then I would also encourage people to continue to DM me questions.
Perhaps we could start with Margot.
So, I think the pandemic has actually, in some ways, just accentuated what's always been true, right? It didn't create these divisions; it just played off of them, and so I think we saw a few things that I would just maybe point out. Many of us, for many years, have been trying to raise the fact that congregate shelter is definitely not housing, nor is it really safe or healthy for anyone. And I think in the pandemic, we saw the impact of that, where all across the country, and certainly here in San Francisco, we saw very large outbreaks of COVID. Having, I don't know if anyone's ever spent time in a homeless shelter, but they are often large, poorly ventilated rooms with lots of mats on the floor, or, cots sitting right next to each other. It's kind of a nightmare for any respiratory illness, as well as a lot of other problems. So we saw that. We saw, as TJ mentioned, the shutting down of many things because people couldn't really be safe in shelters. They had to decrease the number of people in the shelters to try to decrease the impact. And so many more people were out on the streets as opposed to being in shelter. We did see some good things, which I think in some ways are proof of concept, right? When it became obvious that this was coming down, there was a big effort. There was a recognition that there were all of these hotels that were suddenly empty. And I was actually involved in that effort. I was up at the state emergency operations system, trying to figure out how we could repurpose those hotel rooms for safe non-congregate shelter. And that happened very quickly. Like in a matter of weeks, we had 25,000 hotel rooms opened up across the state and then filled right away. To me, that is more proof of concept of everyone saying like, oh, people don't want to be housed, or people can't move indoors or something. What can happen when you actually just make it happen? Obviously, that wasn't housing. It was just non-congregate shelter. They weren't perfect. There were all sorts of complications that I'm happy to talk about. But it was a heck of a lot better than being in a shelter or being outdoors. And it happened really, really fast. I think that all of us are terrified of the tsunami that's going to happen, because in COVID, it was the low wage workers impacted the most economically, and the wave of eviction. So you've had these layered eviction moratoria, and as was mentioned in California, ours lifts on the 30th next week. And it's sort of, a little scary as to what could happen. I guess the one The one other thing I was just going to say is I think the other thing that it made clear, which has always been true, is that homelessness or houselessness is really just the tip of an iceberg of a longstanding problem. And then I will say in the first couple of weeks of COVID, I took it upon myself to call everyone in our clinic who was tested for COVID to give them their results. And if they were infected, I was calling them every day to check in on them. And I was doing sort of early case investigations because we didn't even have everything set up yet. And so I started to talk to people of like who else was in the house. And person after person, I was talking to families where someone was a frontline worker. They couldn't shelter in place because their work was not able to be done at home like many of our work was. Their work was not. They got exposed and got infected by COVID, and they came home to their house where 15, 16 people were living in a 1 or 2 bedroom apartment with 1 bathroom. And inevitably COVID just, spread like wildfire through those housing situations. This is what fueled the pandemic across the country, was this toxic mixture of essential workers in overcrowded housing. So I think it maybe just unroofed the fact that what we see on our streets and in our shelter system is really just the tip of a complete and total failure of housing. When people are living, 14, 15 people in a 1-bedroom apartment, their lives are destabilized and they're at risk of illness.
Yeah, it's really tragic, the conditions that some people are forced to live in during the middle of a pandemic. But thank you for the work that you've done on that. TJ, do you have something that you want to add based on your experience with this community?
Yes. Just like I just want to I guess highlight the fact that the SIP hotels have been godsend for many people who are unsheltered homeless. And just want to add that when the pandemic happened, or when the pandemic was in its early days, with the health order taking effect, what it did is it effectively shut down the shelters for unsheltered people. The shelter reservation wait list, which is about 1,000 people long, was immediately closed down. So that avenue was closed to several thousand people. And it's just and just to reiterate Rachel's earlier point, that services were pretty much sparse to begin with. A lot of organizations that served the unhoused community had to close down. So that left a lot of people who were living outside with literally no place to go. But going back to the SIP hotels, we've been hearing a lot from SIP residents, that how beneficial that the program was to them, and people are getting care for the first time in their lives, and they would. I mean, the fact that a lot of people moved into those hotels, pretty much debunks that myth of service resistance. It's just that's pretty much what I have to say to that. So
Yeah, when accessible services become available and it's accepted overwhelmingly, that seems like pretty good evidence that people want and need services.
Yeah.
Hey, Shanti, do you want to add to this?
With the appropriate services, they're not necessarily resistant to the services. It's the other way around. The services are resistant. Services offered to people are resistant to people.
You just cut out at the end right there, TJ.
Okay, I was just saying that people aren't service resistant. They're the services what are offered are resistant to people.
Gotcha. Yeah, absolutely. Shanti.
Yeah, I mean, I'll just say, I mean, we're 3 days away from a lot of eviction protections ending, which is not certainly not what we wanted, right? But yeah, I mean, in terms of the COVID impact, it's just from a tenant organizer's perspective, it's just turbocharged all the issues that we were having before COVID. But it's really one of the things. I don't want to end on a super down note because I've been super inspired by all of the organizing and efforts that have happened in spite of all of the forces that have been arrayed against people representing tenants, housed or unhoused. But it's going to be challenging fall and winter for us in California. I'm not going to sugarcoat that, especially because, one of my greatest concerns too is, are we going to keep making, how much further can we keep pushing all of these inequities? How much do we keep widening them before, something has to give, right? And so we'll see what happens with, there are some protections in place, but they're not anywhere near what we needed them to be. Particularly for the couple million tenants and families who still in California who still have a lot of debt. The millions of people who haven't gotten their rent relief out yet. But it's going to be a big fight. And I think there's a structural attitude, I think, among some people, particularly in like Sacramento and the governor's mansion, but just in society in general, who want to declare that COVID is over, and it's not. So
Yeah, and that kind of brings us to a good place to conclude, which is that we wanted to turn it back to all of as panelists and let you share any final thoughts and future directions and any organizations that you might want to plug. We have a little over a minute for each of you. We'll start with you, Rosemary, if that's okay.
No problem. I will keep it quick. I really appreciate, I've been inspired. I always love having conversations about how we can fight for a world where housing is no longer a question of if you have housing, but that we all have it and that we all are thriving. So thank you for providing this space. Thank you for the planners for having us here. Thank you to my fellow panelists, because it was great learning from you and talking with you. The thing that, I'm always inspired by is not only the contemporary work, but also the historical work that's been done. A lot of the tenant activists that are unsung, that will never be named or oftentimes forgotten. I try to lift them up and look back to them to remind me that we always have movement ancestors holding us up. And the one woman that I will highlight, who was taken from us prematurely, but then again, that's anti-Black racism for you. We're exposed to premature death. As Ruthie Gilmore once told us. Her name is Yolanda Ward, an organizer in DC who was murdered in 1980, did organizing around rent control. And so she reminded us that it's important for us to always think about how capital benefits. And when we offer our proposals for housing justice, to always think about how do we center tenants in the justice for the working class, as opposed to trying to lift up how capital and real estate interests benefit. Thank you.
I can go. Yeah, no, thank you. This panel was wonderful. It was wonderful to meet all you panelists too. I hope we can stay in touch. I'll just quickly plug. I'll say, if you need resources to help organize your building or need to know your rights or anything like that, I mean, we've got one stop, www.tenantstogether.org. You can also find us on Facebook and Twitter at Tenants Together. And the only other thing I'll just post, and I'll post this in the chat, there is going to be an action for those of us, for folks who are San Francisco based, protesting the end of the eviction protections. And it's going to be on Wednesday at 3:30. So yeah, it's a little bit middle of work day, but if you can make it out and join us, I believe we're starting at the Embarcadero. I will paste that event in right now.
Thanks.
And every time somebody mentioned something about a final thought. I keep thinking about how the Jerry Springer show ends each episode. Anyway, my plug, as it were, is like if you want to learn more issues about homelessness, you could like go to the Coalition on Homelessness website, cohsf.org. You could also, we also publish a bi-monthly newspaper called Street Sheet, and you can buy like, you know, a paper like from a local vendor, $2 a piece, in cash or by Venmo. And we also, Street Sheet also has a website, streetsheet.org, and Street Sheet is also available on social media on Facebook, Twitter, and Instagram.
Great, and a huge shout out to Street Sheet, which is always great. TJ, actually, are you still talking or? Okay, love Street Sheet, and I'm really honored to be on this panel with these panelists. And one thing I really want to shout out about this panelist is taking a structural approach as opposed to looking at this as an individual problem and recognizing that we're not going to solve homelessness by looking at individuals, but rather by looking at the structures that sort of created the system that was, as people say, the system is, you know, operating exactly as designed in many ways. And we need to disrupt that if we actually want to change that. So I just want to maybe do a call to action for the others of you at UCSF to join us in sort of using our voices proactively to think about the structural root causes here. Many of you are scientists or epidemiologists, you're used to thinking about root causes. And I think it's important when we look at this to actually look at the root causes and actually try to disrupt them and get to a solution. I think it's easy to feel hopeless, like there is no solution here, but this is a human-made problem and there is a human-made response, right? This is about organizing. This is a set about readjusting policies to get us the response that we need. This is not some, you know, awful, impossible to cure cancer that we haven't cracked the code yet. This is a policy failure, and it's deeply ingrained, but it can be changed. So thanks for joining.
Thanks for that bit of optimism, Margot. And next up, before we bring the meeting to a close, Chad, did you want to say a little bit about the SPG?
Yeah, I just wanted to thank all of our panelists all at once formally. Please join me in a virtual round of applause for everyone.
Thank you.
And thank you so much for joining us today. If you like this event, or if you hated this event and have ideas for what we should do instead, please join us by going to our website, spg@ucsf.org, or email us at spg@gmail.com. We'll stick around for a few minutes to answer any questions about the Science Policy Group. Thank you again to all of our fantastic panelists. We really appreciate you answering our emails, and everyone have a great evening.